Hey there. Thank you so much for joining me. I am really excited to bring you this free seminar. Originally, I was going to present it at Uplifters, but it is a holiday weekend. So all the people who were interested were not able to come. So I just decided to do a recording, and that way you guys can enjoy it for weeks to come. But thank you for being here with me. So my name is Molly. I am the founder owner of 48 Physio, and it's been a joy to partner with Uplifters. Everything that I've been able to do with them so far has just been awesome. I've loved meeting all of you guys and getting to know everyone, and hopefully getting to treat some more of you soon. So, just a little bit about me first. 48 Physio is a company that I started after going to school and working in a few different places. I realized that not every location has the patient's best interest in mind, unfortunately. So I started a cash based service with very few things that I can't do to help you. Um, so I'm really, really happy to be here, and you can go to my website to learn more. But let's jump into it. So, overall, my vision when I work with clients is first and foremost to educate. I want everybody to walk away with a better understanding of their personal anatomy and physiology and how their body works, as well as a functional knowledge of how you can achieve your goals knowing about your anatomy and physiology. And finally, taking all of those things into factors with each other to assess your unique situation so that you can achieve your individual goals. So, overall, my goal is to educate and empower so that you can achieve all the things that you were created to achieve. So, knowing that, I wanted to do a seminar. So, this seminar is about lower back pain specifically. So, when this workshop is completed, I have a few goals that I hope you are able to walk away with once you're done watching it. Um, First and foremost, we want to teach you guys about your anatomy of your spine and your back musculature. We're not going to get into all the nitty gritty, don't worry, but it is important to be able to understand how your back was created and how it works and moves so that we know how not to injure it and how to take care of it the best. I also wanted to touch base on what the big fancy word is is pain neuroscience education. That basically just means the science of pain, what pain is, how to manage it, and why it's important to know about it. And then the best part, I think, is the do's and don'ts for your back during workouts and really daily life, because you don't just lift things when you go to the gym, right? You pick up heavy boxes that are delivered like cat litter, or lifting up a container of water or anything like that. So even if you're not a gym goer yet, this is still important to learn about. So let's jump right in. So this image here is a pretty decent picture of some of the muscles of the back as well as some of the bones. You can see a lot of the vertebral bones as well as the sacrum, some of the bigger muscles like the glutes that everybody is probably familiar with. This table breaks down a little bit of the key facts about back anatomy. There's a lot of jargon in here, so we're not going to get into all of the details, but I did want to highlight some important things. So, first, we see the bones and the joints. I did want to point out that if you have lower back pain, it's also important to recognize that we need to assess the joints and the structures above where you have the pain as well as below where you have the pain, because sometimes those structures are involved even if we think they're not. So, um, just wanted to point that out. And then I also wanted to point out that there are superficial muscles and deep muscles. So, superficial is something that you can touch more easily. So, like a glute muscle, most people don't think of that as a back muscle, but it's very closely related. So, I would consider that a back muscle. Not pictured on this diagram is your latissimus dorsi, which is your lats. That's a huge muscle. It would cover up all of these deeper muscles, but that would be a superficial muscle. And then these are just some of the deep muscles. There's even more. But I just did want to point out that if you are only training your superficial muscles or the muscles that you can see or touch, you are likely going to increase your risk of injury in the long run. We want your deep muscles to be just as strong, if not stronger, than your superficial muscles, because those are the ones that are really close to your spine and other areas in your body that are really important for stability. So they help provide the foundation of strength. So we want to train those deep muscles for sure. Then we go into the nerves. There are a long list of nerves here, and there are even more. That's the only thing this picture doesn't show, but there are many nerves involved in the lower back and in the back in general, and they all travel down into the lower extremities. So we want to make sure that we take care of our back, because by doing that, we are also taking care of the nerves and the structures that travel down into our lower extremities, like our knees, our ankles, and our feet. And then there are some arteries and veins, and those are important too. But we're not really going to talk about that today, because you don't really need to know a whole lot about that. But I did circle the function of this chart, because that's, to me, the most valuable thing that you can walk away with a knowledge of. So we can read these. The protection of the spinal cord is one thing that the back does. Our spinal cord is obviously very important. If we have any sort of injury to the spinal cord, you can think about things like paralysis and the inability to move your body at all. So its number one function is protection of the spinal cord. It also absorbs mechanical force. So anytime you jump, your back is going to be there to help stabilize everything and make sure that you don't fall apart, basically. It helps maintain posture of the body and head. So you think about how long we sit or how long we stand throughout our lives. I mean, we spend the majority of our time either in one of those positions, sitting, standing, or laying down. And when we're sitting or standing, gravity is actively pulling down. So all of the joints and the muscles and the bones in our back help maintain posture so that we can be aware of our surroundings and all those things. Coordination of the limbs and movements. All the rotation that our back is able to do helps us reach things. So it helps us use our legs and arms. And it also assists in respiration, which is breathing. So all of those things are the function of the back. And one of the biggest things I wanted to point out was that if you are not training to improve the function of your back or to support the function of your back, you may as well not train at all, because if it can't function, you're not going to be able to perform. So moving on to lower back pain. What is lower back pain? So I'm going to jump down to a few bullets here, but an estimated 84% of the population worldwide is going to experience some sort of back pain in their livelihood. If you're watching this, you are probably at least interested in lower back pain or have had lower back pain, know of someone who has had it. So it's very, very common. Basically, it's just any unpleasant sensation or discomfort around the joints of the spine. In terms of longevity, we categorize it into acute, subacute, chronic, or acute on chronic. Acute is, less than 5 days. It hasn't really gone into the stage of degeneration yet. Subacute, between 5 and 15 days, so about less than 2 weeks. That's when we want to start thinking about getting some more treatment from a professional instead of trying to self-treat. Chronic is anything longer than 6 weeks. Acute on chronic is just like it sounds. If someone with chronic low back pain has had a period of stability where they're doing pretty good, and then they have an acute injury on top of that, that's a whole separate classification as well. In addition to how we categorize the timeline of low back pain, we also categorize what type it is. So there are many different kinds. This last bullet here, some require more medical attention than others. So inflammatory low back pain, oncologic, which means comes from cancer, or infectious low back pain. Those are the types of things that you would not come to a physical therapist for. You would go to the hospital for, or be treated through pharmacology or traditional medicine. The most common types that I work with and that most PTs work with include mechanical low back pain or degenerative low back pain. So we're going to talk about those a little bit more. These are just a few types of mechanical and degenerative low back pain. There are a few different combinations that you could think about, but we're going to review just the 4 most common types. So a derangement is what we would consider something related to a disc issue. So a spinal disc is the structures that are in between your spinal vertebrae, and it's where the nerves exit out of your spinal column and travel to different other areas of the body. So the most common example that people are familiar with is sciatica. So you usually think about kind of a nerve type pain with derangement. The next type is dysfunction. So this is what we call somatic in nature. It's usually related to a muscle issue, and it's causing that aching, cramping sensation pretty much right over the area that is causing the pain, usually. And then we also have combination, which is just like it sounds. It's a combination of the two, derangement and dysfunction. This is actually pretty common. Usually, people that have a derangement develop some sort of dysfunction, or vice versa. Um, if you attempt to self treat, it's important to know that you want to address your derangement before your dysfunction for a number of reasons, which is why it's really important to go see a professional, because if you don't know which type of back pain you have or how to treat it, you can end up making things significantly worse. And the last type I wanted to talk about was instability. This can either be a functional stability or an innate instability. So, functional meaning that you're not able to properly utilize your muscles. We like to use a term called motor control in the physical therapy world. And that basically just means how your brain tells your muscles how to work. So, if you're not able to, for example, utilize your glute muscles as well as we would want you to, that would be a functional instability causing some of your pelvic misalignment or your back misalignment. Um, it could also be an anatomical anomaly that you may have been born with or have acquired over the years. So maybe post surgery, if you've had a disc fusion or something like that. There's also a subtype of instability that I wanted to mention. It's including pelvic girdle dysfunction. That can be due to a hypo or hypermobility issue in the pelvic girdle region. So that's pretty common among women who have been pregnant before, who have delivered either naturally or via cesarean. And that's a specific type that I really enjoy working with. There's a lot that goes into that, but it's a pretty rewarding population to work with. So these are just some factors that increase your risk of low back pain. I wanted to go over these for you personally, as well as so that you have a knowledge of what increases low back pain risk for your friends and family, so that you can help them reduce their risk. Um, the first one is pretty interesting, I think. If you believe that pain is harmful, that's going to increase your risk of low back pain. So, we're going to talk in just a few moments about the pain neuroscience and what pain actually is. Is it really harmful or is it not? We'll find out. And also, if you believe that activity is harmful. So, everybody at Uplifters who is watching this probably doesn't believe that activity is harmful, which is a good thing. But some people do. Some people think that certain types of exercise or exercising in general can cause issues in their body. So that's one of the things that can increase your risk of low back pain. The next one down, low or negative moods. So people who have depression or who maybe stay inside a lot. I know for sure during the COVID pandemic, when people were staying inside away from friends, the incidence of low back pain increased significantly. Part of that was because people were not around other people, and it's easy to get depressed when you feel lonely. Next one, treatment that is not evidence based. I lightly touched on that earlier. Trying to self-treat is a very admirable thing. However, low back pain is a pretty complicated diagnosis, and if you do, unfortunately, misdiagnose yourself or do something that isn't evidence-backed, you can potentially make your symptoms worse and increase your lower back pain risk. Over here on the right side, if you have a history of low back pain, your risk of having it again is higher. Or if you have another chronic pain condition, you're probably going to experience some lower back pain in your life. The next one is problems at work or home or poor job satisfaction. So again, this ties right into those feelings of depression or just unsatisfied with your daily life, which I think is a pretty interesting thing. We don't think about, or at least I don't think about a lot, the role that psychology plays on our physical symptoms, and that's a big one. And then the last one is heavy work or unsociable hours. So pretty similar to some of the other ones, but I just wanted to point out specifically people who have night shifts or who are doing pretty heavy manual labor. So thinking about your contractors, your construction workers, those types of individuals do have a significantly higher risk of lower back pain at some point in their life. So what is pain? We've talked a lot about that. I've thrown out the word pain more than I care to. So pain is normal. I mean, we're created to experience pain so that if something is wrong, the brain tells us what to do, right? So the most common example that I can think of is if the stove is on and it's hot and you touch the stove, ouch, that hurts, right? Our reaction is a result of what our brain processes as pain. We touch the hot stove, the brain says, that's really hot. If you keep your hand there, you're going to burn your hand. So we remove our hand. So that's just one of the examples. But not everyone experiences pain in the same way. So there are a few different diagnoses where someone might touch a hot stove and not realize it, and it is actively burning them, but their brain is not telling them, that's a hot stove, remove your hand, and they end up injuring themselves. Another pretty common one that people are usually familiar with is autism. If people who have autism, they tend to have a higher pain tolerance, which is very interesting. But there are a few other diagnoses similar to that. So these 4 points come from a very highly respected physiologist in Australia. I've linked all of my sources in the notes so you can read more about him. But the perception of pain is shaped largely by the information given to us or from whom we turn to help, right? So that's just a really interesting psychological factor that goes into many more categories other than just pain, but we perceive what we feel based on the information that we know. Increased number of risk factors that we just went over. You are more likely to experience pain if you have those risk factors, obviously. If you believe in outdated biomedical models that pain resides in the tissues, which is an interesting concept, right? It seems kind of like common sense when you think about it, that the nerves go to the brain and the brain is processing what's happening. You don't have little brains inside of your muscles that are telling you if this is pain or not. Pain is just a perception that the brain classifies, just like any other sensation, like pleasure or anything like that. And then the last one is also very interesting. Men and women experience pain very differently. This is just a fact of our physiology. And how we are created. So moving on to some things that decrease your risk of low back pain. So we're on the positive notes here. Reducing your weight overall if you're obese. So your total body weight, if it comes down into a healthy range, you're reducing your risk for lower back pain. And in general, reducing your abdominal weight distribution. So the easiest example is pregnant women. Lower back pain during pregnancy is fairly common due to the fact that the abdominal circumference increases significantly, and that pulls on some of those lower lumbar segments. So that's just an example, but it can apply to everyone who is not pregnant, right? If you think about a big old beer belly, that's going to do the exact same thing. So decreasing the weight distribution in your abdominal area is going to reduce your risk of lower back pain. Increasing your physical activity. I like to point out that you can do that a few different ways. My favorite way is to do it with intentional physical activity, meaning that you are putting on an outfit and putting on your shoes to go outside and go for a jog or go to the gym, and you're doing a specific workout. You can also increase your physical activity just by doing activities of daily living. So instead of sitting down to work at your laptop during the evening, you can choose to stand. Getting a few more steps in during the day by choosing to deliver your laundry loads one at a time. There are many different creative ways that you can think about it. Quitting smoking and reducing stress. I put those together because hopefully none of you are smokers, but if you are, you should think about quitting just for the sake of reducing your risk of lower back pain, although there are many other reasons to want to quit smoking, but also to reduce stress in your life and on your body. So smoking is one of the things that we know stresses the body out. It increases cortisol and a whole bunch of other chemicals that increase your risk of low back pain. So by quitting smoking, lowering your stress exposure, you're going to reduce your risk of low back pain. Maintaining good posture. So if we think back to one of the functions of your back, it's to help keep your head and the rest of your body with good posture. If you are able to maintain appropriate posture, utilizing some of those deep muscles, you're going to reduce your risk of lower back pain. Stretching and maintaining flexibility and mobility. This is a big one. Flexibility is one of the 5 components of fitness. So you should be spending time daily, at least 10 minutes a day, to stretch major muscle groups, especially along the spine. Mobility is the ability to use your flexibility. So don't just stretch. You should also be doing some strengthening as well. And the last one is pretty obvious. If you lift something correctly, your risk of lower back pain diminishes significantly. We're going to go over a few different types of workouts and how to lift correctly. So the key messages for pain neuroscience education. These 10 come from the same source that I mentioned earlier, that physiologist in Australia. You can check out some of his stuff in the notes, like I mentioned, but these are great points to think about. We're going to go over some specific ones as it relates to workouts. So we all increase our relative risk for injury when we work out, just because we're not sitting on the couch. If you're sitting on the couch, you're probably not going to get injured. If you start to do a squat, your risk is increased. But it's a risk worth taking, okay? So learning to plan your workout is something that we all need to do. So at Uplifters, we have prescribed workouts, right? Everybody gets the same workout written down on the whiteboard. But learning how to plan your workout is what I would like to go over at this point. So that's point number 2, is to modify when needed. That's probably the biggest point. We'll just start with that one. Just because it's written down on the whiteboard doesn't mean that you have to do it as prescribed. You can modify, make it less challenging, or you can progress it, make it more challenging. So that's one of the factors that you can think about. Jumping back to the first one, having appropriate accountability. Uplifters, again, is a great place to have accountability. Everyone there is awesome. You want to have someone who will hold you accountable for pushing yourself, but also someone who will hold you accountable for times when you maybe shouldn't push yourself so hard, reminding you to stretch, those types of things. That's what accountability should look like. And jumping down to number 3, self-awareness. In general is just a good thing to have, but especially when you're working out, you do want to make sure that you are self-aware of your current condition. So let's say you slept wrong on your neck one night and you come in for the workout the next day and it's all upper body. Being aware that you have slept wrong and that your neck isn't currently feeling like it normally does is something that will save you a lot of pain in the long run. Asking questions. The trainers at Uplifters are awesome. They are super, super knowledgeable. To become a personal trainer, you have to be a certified personal trainer. And I can verify from my own experience that it is not an easy exam. You have to study for it. You have to learn a lot about anatomy and physiology and biomechanics and all of these different types of things. I say all that to remind you that your trainers are well-educated, equipped people to answer your questions. You're paying for a gym membership, but you're also paying for utilizing the trainer. So ask questions, okay? Obviously, if I'm there working out as well, you can ask me too. The next one, form is more important than weight. I wish that I had bolded this and underlined it because it's true. I am definitely guilty myself of being like, oh, I can do more weight, and then my form suffers, and lo and behold, I hurt my back. So please keep in mind that form trumps everything. You should be able to perform every exercise that you do with appropriate form without failing in that form before you go up in weight. And the last one, we already talked about it, is the importance of stretching. 10 minutes a day is what's recommended, but I'd like to double that and say 20 minutes a day if you have time for it is great. Trying to stretch the major muscle groups, the ones that you have worked during your workout, as well as some of the minor muscle groups and muscles in the neck, things like that. Some of the stability muscles is important as well. So now we get into some of the specific movements. I wanted to go over some of the major ones that we see at Uplifters, as well as some of the main components of exercises. Even if we're not doing a deadlift, right, we're going to be doing a similar motion when we pick up our case of water from the grocery store, things like that. So, starting with the deadlift. And please also consider that these 3 deadlift, squats, and overhead movements, they're all what we consider spinal loading exercises. They're going to put an increased load on your spine. It's just something to consider if you have a history of a disc issue or a compression injury or anything like that. Just something to be aware of. So, deadlifts. Your setup is everything, as with most exercises, but especially with the deadlift. Some key things you want to look out for are the position of your feet, depending on what type of variation you're doing. If you're doing a narrow stance deadlift, traditional deadlift, sumo deadlift, those types of things. Setup is everything. So make sure that you know how to set up correctly for your body and for the exercise that you're doing. Lots of variations are available on a deadlift. So let's say you go into the gym at Uplifters and you see barbells loaded with the plates, and you're like, oh man, I can't do those. Don't worry, you can still do the exercise that is prescribed, a deadlift. You're just going to modify it a little bit. So some examples would be using a dumbbells instead of a barbell. You could use kettlebells. You can go through a partial range of motion. So we can elevate the barbell on some boxes, and you can just go through the top range of motion. You can adjust the speed at which you're lifting. If you just do one rep, one really good controlled rep with excellent form during the time, like the style of workout is at Uplifters, that's great. Maybe trying a single leg deadlift, that would be a little bit more of a progression. You won't be able to do as much weight, but you're progressing to work on balance while you're doing that. So you can think about all those different variations. A big one with this is considering your mobility before attempting. So not just flexibility, which is can you touch your toes? Mobility is can you touch your toes and pick up the weight? That's using the flexibility that you have. Specifically here, we're using a lot of hamstrings and our glutes especially to engage on the way back up as we extend our hips into standing. So then moving on to squats. There are options with this as well. Let's say we're using a barbell. You can position the bar a little bit differently on your back. You can do what's called high bar or low bar, which is just as it sounds, the position of the bar high up on your traps versus low down, a little bit lower on your back. That's going to change the load on your body and how you lift and what muscles you utilize. Again, you can use dumbbells, kettlebells if you don't want the barbell, a resistance band, or just body weight. And then I also wanted to point out depth in relation to your goals. So in this little example here, this guy is going a little bit lower than 90, but pretty much at 90 degrees. We're going to be using specific muscle groups when we do that. Versus if you hear people say ass to grass, you're going to be using a little bit different muscle groups when you think about doing that exercise. A lot plays into this, specifically femur length in relation to the rest of your body. There's an excellent video that I have linked. It's a short Instagram video. It's in the notes, so you can check that out and watch it and learn a little bit more about that. Another thing I didn't put on here, but relates to the femur length, is if you have anything under your ankles, or specifically under your heels, the higher your heel is elevated, the easier it's going to be for you to increase your squat depth. So if your goals are to squat really low, try elevating your heel a little bit. You'll achieve that goal a little bit more. Or you can work on your ankle mobility. Hopefully you're doing both. But if you have ever seen Olympic lifting shoes, they have a little bit of a heel to them. And it's for that reason. It's so that things are a little bit more efficient during some of those high-speed power movements. So anyway, I digress. Last one on this slide is overhead movements. So this can be anything from a shoulder press, overhead tricep extension, picking up a ball and slamming it down, doing some ball slams, as well as handstand push-ups. Even though you're inverted, you're still technically pressing your body weight overhead. Especially in these situations when we have a load that's overhead, we're using our core pretty significantly. Obviously, you're using your core in everything that you do, especially deadlifts and squats, but it's notable in these exercises because your abdominal strength needs to be able to support your spine to the point where you don't overarch your back and increase your risk for injury in the the spinal segments in specific areas. And then I wanted to go over some abdominal exercises, specifically for lower back pain. Abdominal exercises might be maybe not the number one, but they're up there in terms of exercises that cause or at least contribute to lower back pain. The first is planks. I wanted to go over. Planks are probably some of my favorite exercises. It's what we consider an isometric exercise for your abdominal muscles. Your abdominal muscles are not moving. Iso means same length. They're staying the same length and they're holding your body in that same position. So it's just a static, not moving exercise. It's just you versus the clock, right? In this position, gravity is actively trying to pull your belly button down to the ground, while your abdominal muscles are trying to maintain a little bit of that flexed position. You're using your deep back stabilizers as well to help maintain neutral. Similar movements would include mountain climbers, ski jumpers, or toe touch planks. Those are all not quite the same, but very similar. One of the most common mistakes that I see with planks is that people like to bring their arms together like this. You are going to utilize your oblique muscles and a significant amount more of your deep stabilizer muscles if you take your arms from this position and turn them into this position. So we really, really, really want to see those arms being parallel. Next time you try a plank, give it a shot and tell me what you think. But I would love to see that at Uplifters if everyone had their arms parallel. The next one is sit-ups. Sit-ups are probably my least favorite exercise for your abs, and it's because they don't really work your abs. Yes, your abdominals are engaged and working. However, the primary mover for a sit-up is going to be your hip flexors or your iliopsoas muscles. So any crunching movement like that is going to be similar. So here I thought of V-ups, 6-inch holds, and flutter kicks. Those are probably some of the most common sit-up variations that I see during Uplifters workouts. I say all this in a negative sense, but I don't mean it in a negative sense. It is perfectly fine to perform these exercises if you are able to maintain a neutral spine, meaning that your abs are engaged properly to keep your spine where you want it to be. And your goal with the exercise is to work your hip flexor muscles. If that's not your goal, then we should consider other exercises to work the abdominals more efficiently. If your back is arching at all, you're wasting your time doing this exercise for obvious reasons that I just explained. Really, we need to be stretching our hip flexors because of the amount of time that we spend sitting. So we'll go over that if you have questions on that. The last one I put on here is speed and power drills. So things like sprinting, box jumps, what else I put on here? Skaters, lunge jumps, all of those types of things are speed drills. Some of them are power drills, depending on if you have resistance. They're all excellent movements, but anytime you increase speed with something, you're decreasing control in general. So when you're moving faster, you have less control over your body and you're increasing your risk of injury. So we just need to be aware that that's a fact of what happens with these exercises. Asking for modification, especially as fatigue sets in, is really important. So let's think of an example here. If you're sprinting and you start to fatigue and you just start to go into a jog, that's fine, but you're not really working on speed and power with a jog. You're just working on endurance. If you wanted to continue to work on speed and power, I would highly recommend going and asking one of the trainers for a specific recommendation on how to do that if sprinting is not an option. Speed and power drills are also excellent at helping with Olympic lifting, so your snatches and your cleans. So if you do any of those exercises outside of uplifters, just consider that it's important that you continue to train speed and power, and going down into a jog or a box step isn't necessarily going to help you achieve those goals. So that was a quick rundown of lower back pain and a little bit about pain neuroscience. And I just wanted to go over a few of the exercises at Uplifters and how we can adjust some things. So thank you for watching. I really appreciate it. I would love the chance to meet with any of you one-on-one and go over any questions that this might have brought up, or to go over some specific modifications for you during your next exercise. I also wanted to make everyone aware that I am coming out with a quick guide to exercise modifications and progressions. So we're going to go over more exercises than just the 6 that we reviewed here. And we're going to give you specific modifications that you can do and progressions as well. So that's going to be a great resource. That will be here soon. So I love your feedback. You can contact me in any one of these ways here. This is my cell phone number. You can text me or call me. You can visit my website, fill out the contact form through there, or you can email me directly. I'm at Uplifters Monday, Tuesday, Thursday, and Friday from 8 to 10. I'm also at Sage Wellness a few other days during the week. So thank you so much for watching, and I hope you enjoyed and learned something. Please make sure that you I put sign in here because we had planned to do it in person, but if you just comment below or somehow let me know that you watched the video, I'll put your name and your information in for a chance to win a $50 gift card. So I hope you all have a wonderful weekend. Thank you so much, and I'll talk to you later.